Okay, adductor group. We're not going to go through our class in all 5 adductor groups, but we need to know by the names, which is the pectineus, the most deepest one, and close to the inguinal ligament, adductor brevis, adductor longus, adductor magnus, and the last one is the gracilis. All of them they call adductor group because their action is a ADD or is a adduction of the, so bring the leg towards the midline. In all adductor groups, in all 5 of them, which is in the middle thigh area, only one of them passes the knee, which is the gracilis. A good common thing is about all the adductor group is that origin is close to the pubic ramus, inferior or just medial or anterior in that area. For our class, you need to know just is in the pubic area. We start in the first one, adductor magnus. It's a really broad muscle that is the anterior. They have 2 origin and 2 insertion. Anterior head is the pubic, where the posterior head is the ischium tuberosity. And we know that this is the 4th muscle going to the ischium tuberosity, including the 3 hamstrings. And going down, we have the 2 insertion. One of the insertion is the
Linea aspera of the femur.
linea aspera of femur, which means it's the anterior part. Anterior part is linea aspera of the femur, and the posterior part is the adductor tuberosity of the femur. So, getting 2 origins and getting 2 origin and 2 insertion, this muscle, the priority action of this muscle is a deduction of the humerus. But if the anterior head works, we have flexion and medial rotation, and if the posterior heads work, we have the extension and lateral rotation. So the best way to stretch this muscle is just doing the ABD. That's the way we stretch better this muscle. So if you're going to do by imaginary line, so most likely we are just starting here, but we're going to go here and the other side here. So is this muscle, that broad muscle here. So this is the stripping, and this is the cross fiber. And these are the 2 heads, linea aspera and then adductor tuberosity in the other side. Cross fiber, it's a superficial muscle, yes, but do we have gracilis on top of that? Correct. The 3 adductors are underneath the magnus, but gracilis on the top. Now gracilis, also like adductor magnus, does ADD, so they can be synergist to each other. All those adductors, guys, are synergist with each other for ADD. For ABD, the best antagonist to adductor group is the gluteus medius. That will be the best for the ABD, or antagonist of all those 5 muscles. Gracilis, more superficial, more medial, and also the only muscle in the adductor group that passes 2 joints, the hip and the knee joint. Origin, as usual, in the pubic, runs all the way down here, pass the knee and goes where?
Which one are we doing?
The insertion of the gracilis, guys.
Yes, the medial proximal tibia.
Medial proximal tibia. So normally, as you see, it also goes to the tibia, passing. So by passing the tibia, here is another muscle that can help also on the knee area. So the main action of the gracilis is ADD. Okay, but by passing the knee area, does the flexion of the knee and also help to the medial rotation of the knee. It's a strong muscle, no, but yes, helps that area. Okay, and there we finish the adductor groups out of 5, so we just learned 2. One more time: pectineus, brevis, longus, magnus, and gracilis. All do ADD. But for our test, we're going to focus mostly on adductor magnus and gracilis. And from here, now we're moving on to the lower leg. We have one muscle here they call anterior tibialis, and anterior tibialis we have the tibia here, as you see it, and the origin is the lateral condyle of tibia, and runs parallel in this direction, cross foot here, and stops to the base of the first metatarsal and the cuneiform tarsal. There's the insertion. By seeing this is also the way of the muscle stripping. So this way we strip the tibialis, anterior tibialis. What is the action of this muscle? This muscle is one of the strongest muscles that does dorsiflexion, and inversion. Without this muscle, you're not going to be able to walk because this is the muscle that just lifts your toes when you walk. And this is the muscle that we call also that injury, or they call the tibialis syndrome or anterotibialis syndrome or the shin splits, as we know. Superficial, yes, it is superficial muscle. Synergist for inversion can be tibialis posterior, and antagonist can be gastrocnemius and soleus for the plantar flexion. Next to the tibialis anterior lateral, we have the peroneus longus. Peroneus longus, if you can just hit it here, this is the head of the fibula. And upper third of the fibula, there's the origin of the peroneus longus, runs on top of the peroneus longus, also called the fibularis longus, so they run on top of the fibula, goes around the lateral malleolus. You see here that we have medial malleolus, and this is the lateral malleolus. So just go around here. From this position, goes on the back, on the bottom of the foot, and share the same insertion with the tibialis anterior, which is the first metatarsal and the cuneiform tarsal bone there. So as you see, if you can get both those two muscles, they run parallel to each other from here, and here they just cross and wrap the leg in both sides. And just stops in the same insertion. By having the same insertion doesn't mean that those two muscles have the same action. They are antagonists to each other because one runs on the front and does dorsiflexion, one runs on the back and do plantar flexion. One runs, grab the first metatarsal and does inversion, while the other one grab the first metatarsal but the opposite side and do eversion. So those two muscles are very antagonistic to each other. Synergist to peroneus longus can be peroneus brevis, or also gastrocnemius and soleus for the plantar flexion. Peroneus brevis is underneath the peroneus longus. They consider like if this is the fibula from here till there, and we break this one in three parts. Okay, so lower 2/3, just from here, lower 2/3 of the fibula, going around underneath, again in the same direction behind the lateral malleolus, and goes and stops on the base of the fifth metatarsal is the insertion. So the action of this muscle is the same like peroneus longus, which is the plantar flexion because it's behind the lateral malleolus, but also eversion. Why? Because pull the fifth metatarsal up so that the first metatarsal down. So that's why the peroneus longus and brevis are synergists to each other, and the tibialis anterior is antagonist to both of them. And that's how we conclude the second group, 5 group of muscles. And next one, we're going to move on to the hamstrings, gastrocnemius, and soleus.